My name is Dr Mitra Elli and I graduated with DDS degree from Tabriz University in 2000, and then I went to specialty training and graduated as a specialist endodontist in 2003 from Shaybest University in Tehran. I was practicing as a specialist endodontist and I was associate professor in the university, but in 2009 I came to the UK and then I got all my registrations through the ORE exams, etc. in 2018, and I've been exclusively working in the field of endodontics, receiving the referrals for complex endodontic treatments. In my experience, Biodentine is the best material for vital pulp therapy, and it's actually the reason that the Biodentine has been produced. Since I have been introduced to Biodentine, a number of vital pulp therapy cases that I'm doing has increased. But it is not the only and the main treatment that I'm using Biodentine for. There are so many different treatment modalities that I have found Biodentine to be quite successfully used. For example, regenerative endodontics, and I have used Biodentine quite successfully there. Also in dental hospital, we are using the Biodentine and we have had very good results. I use it for perforation repair. I use it for internal resorption cases. I have used it for ECR cases when we are doing internal repair, as long as it's subcrestal. So there are so many different clinical scenarios, cases that we can use a Biodentine for. It's not just vital pulp therapy, but vital pulp therapy is the main reason that I use this product for. Because Biodentine is pulp therapeutic and restorative material, two main things in one product, that makes it really good for vital pulp therapy. But because of its bioactive and biocompatibility, anywhere that we are exposing a material to the soft tissue, it can be pulp, it can be periodontium, this is the material of choice. I have had cases with internal resorption with a perforation. So we have a complexity of the anatomy, we have a really difficult situation to get the good seal, and also a perforation and communication to the periodontium, and this material has worked really well in these cases because of its mechanical characteristics. It flows nicely and gives us a really good seal in the area that getting a seal is very, very challenging, and also because it's biocompatible, the communication with the periodontium when we use this material is not a problem. And because it's bioactive, it actually induces the hard tissue formation and helps with the healing. I think no other material could have given me that successful results. What makes this product quite unique is that this product is pulp therapeutic and a restorative material in one single product. So there is no other material that can do both jobs in one product. That's maybe the reason that it's the best material for vital pulp therapy, because from one hand we can use its bioactive characteristics and biocompatibility to get the pulp healing and also dentin bridge formation, and on the other hand this material can be used as a restoration because studies have shown that its compressive strength and its hardness is pretty much similar to dentin. Not to enamel, and that's why we always need to have 2 millimeters space for the enamel replacement, but this material can be used completely as a restorative material to replace the dentin. The other thing is that other material that have been used, for example calcium hydroxide, as a direct material that we put in direct contact with the pulp, they have not been as effective as this material and to create the dentinal bridge. Some other materials, for example, such as MTA, we know that the radiopacifiers that are used in these materials can cause discoloration. We don't have this problem with Biodentine because in Biodentine zirconium oxide is used, which is very stable and does not cause any discoloration. Another thing about this material is that the purity of the calcium silicate, because it's synthetic and it's very, very pure, and it's 80% made of tricalcium silicate, which makes its biocompatible and bioactive characteristics really, really effective, and that's why we get such great success from this product. In order to choose the right cases for example, vital pulp therapy, because as I said, there are so many different modalities that we can use this material for. There are so many things that we have to take into consideration to make our case selection, and the case selection is very important. But because of this material, we can potentially give chance to some cases that maybe before we couldn't really give the chance for, and we knew that it was not going to work. That is how this material has helped me, that I am now maybe taking in more cases for vital pulp therapy than I used to do before. For vital pulp therapy, maybe the most important thing is the case selection. So we need to know that which case is suitable for this, and that plays a huge role in the ultimate success of this treatment. How do we know that which case is good at this moment? We don't have a very reliable measure to see that what is the status of the pulp and when would be the best time to do the vital pulp therapy. So we need to really combine different things, from taking a good pain history, from doing the sensibility testing, our clinical examinations, our radiographic examinations, putting all together and reaching a conclusion that if this case is a good case for the vital pulp therapy. And not just the tooth factor, you also need to see the bigger picture. For example, in a patient who is not cooperative, in a patient that have so many caries, and a patient with a really unstable periodontal condition, maybe vital pulp therapy is not the best case. With using Biodentine, we can avoid unnecessary root canal treatment. Why we want to avoid root canal treatment? Root canal treatment is effective and successful, yes it is, but there's no better root filling than the dental pulp itself. Why? Because there are so many irregularities inside the canal that we cannot clean, we cannot seal perfectly, and we know that. And also the dental pulp has its own immunity characteristics. It can form hard material, it can form dentine, it can protect the tooth basically. It's an alive and active organ inside the tooth that can actually protect the tooth, and it also has proprioception. So when a tooth has been undergone root canal treatment, even if it's a good root canal treatment, there's always a chance of losing that tooth, because root canal treatment sacrifices tooth structure, makes some changes in the dentine, the proprioception is lost, and because of all that, the tooth is always prone to fracture. And unfortunately, most of the teeth that are lost and root treated are actually lost because of structural compromise and because of fracture rather than the endodontic infection. So we can potentially imagine that we can potentially avoid all these problems and elongate the survival or the time that the tooth remains in the dentition by just avoiding the root canal treatment, and Biodentine makes it possible. As I said before, it's always good that if a tooth does not need root canal treatment, avoid root canal treatment and give pulp the chance to survive, because it will ultimately help the tooth just to live longer. But in the absence of the good material that we can use to help the pulp heal, it's not possible. And unfortunately, this is the case in many of the cases that I was referred, and I can see that the tooth maybe didn't need root canal treatment but was extirpated. And I asked that, why did you not give the tooth a chance? Because, well, basically they don't have the good material to give the tooth a chance. People, when they have any problem with mild pain sensitivity or in general routine examination, when a deep caries is diagnosed, they are going to general dental practitioner or practices rather than the referral ones. And they need to be able to utilize this kind of treatment, and the best material, as I said, for vital pulp treatment. And actually the easiest one, and I will explain why it's the easiest, is the Biodentine. So if that material is there, then many of the teeth may not really need root canal treatment. It's not very good for me, right? So I need referrals. When we make a decision that this tooth might have the chance to survive and do the vital pulp therapy for them, according to ESC position statement, we don't have indirect pulp cap, instead we have selective caries removal. So we remove the caries to the firm dentin and then place Biodentine on the tissue as a biobulk fill. So we fill the whole cavity with Biodentine. And why it's a good material for that? Because number one, it gives a really good seal, because it just spreads into the dentine, and alkaline characteristics has an antibacterial effect, and also it etches the dentinal tubules slightly, and then ions that are released from the product, they go into the dentinal tubules, the minerals, they go into the dentinal tubules and create a mineral tag. So we get a good micromechanical and chemical bond between biodentine and dentine, and that creates a really good seal. And another thing is that this material does not shrink because it doesn't have any resins to it. So we have a good seal, and we have the antibacterial characteristics. We have ions such as calcium and silicate which are releasing, and all of this helps with the arresting of the active caries under this product and remineralization of the dentine. Just imagine that by doing this, we have avoided the root canal treatment, we have avoided pulp exposure, and also we have preserved of tooth structure that previously we were going to remove. So it's basically minimally invasive dentistry, less is more, and Biodentine makes it possible to do that through its wonderful characteristics. When we are going to the cases that ESC position statement calls as extremely deep caries, where the pulp exposure is going to happen, or it happens when we are excavating the cavity from the caries, then again, Biodentine is the best material to put directly into the pulp because of its bioactive characteristics and biocompatibility. And then it helps the pulp to heal and helps the dentin bridge formation. The way I do it in clinic, I used to put a little bit of Biodentine where the pulp exposure was as a direct pulp gap, a partial pulpotomy, a full pulpotomy, and then on top of that I would put glass ionomer and then maybe composite. So sandwich a lot of materials, or maybe sometimes just composite and then flowable composite and then normal composite. At the moment I don't do that. I do instead biobulk fill. That has made my life a lot easier, and I think the procedure becomes much easier, faster, and actually outcome is better. So the way the biobulk fill works is that when you have the cavity, you basically just go in there and then fill the cavity with Biodentine, and you do the minimum manipulation of the material, because this material actually flows quite nicely and it doesn't really need packing and manipulation too much. Just a little bit of dab and it just goes to all those irregularities, and then we just let it do its job, and it nicely then starts to set. And we have like 12 minutes. That's what the manufacturer says, that we have 12 minutes for the initial setting. Leave it, go for coffee maybe, because if I'm there then I will be tempted to do something. And then when it sets, it's pretty much ready. You can do it in two different ways. Number one is to do the biobulk fill, leaving a 2mm space, because as we said, it's a replacement option for the dentine, not for the enamel. So we leave 2mm to be replaced, which is the enamel basically, to be replaced by composite. We can do it on the same session, but the only thing is that we cannot use a strong acid because it will then interfere with the setting of the material. We need to do either self-edge, which is a weaker acid, or do selective edge just on the enamel borders and then fill that 2mm with the composite. What I do and what I like these days is just to fill the whole thing with Biodentine and send the patient home. You can bring the patient back after 2 weeks, up to 6 months. Then that material has done its setting, it has reached a full hardness. It's really nice. You can just trim it for 2mm and then you can use a strong acid if you want, and then fill it with composite. I find it to be really convenient and really easy, especially on that session, which I have done the vital pulp therapy. I do the biobulk fill and then send patient home. And this next time when they come, I can actually assess the case as well. I can do sensibility test again. I can just see that how the symptoms are and do my final composite filling. What I really like is that when I have the biomaterial in my drawer there, I have a peace of mind, knowing that if the patient sits on my chair, I do the test and consultation and everything, and I feel like, okay, there's a deep caries, but this tooth probably doesn't need root canal treatment. I can grab that and do the vital pulp therapy. If in the middle of the treatment a perforation happens, thankfully it doesn't happen often, but sometimes the patients are referred and I open and I see that there is perforation, or patients are actually referred for perforation repair. grab that and I can sort out. So many other scenarios that I am approaching more confidently because I have this material and I know that that's my best friend. It's going to help me out of this situation. And also, it's just in the modern day dentistry, minimally invasive dentistry should be practiced. Why? Because we know that every treatment that is done on the tooth basically pushing the tooth towards the end. If the tooth falls into the circle of death, and we want to try to be as minimally invasive as possible. Avoiding the root canal treatment when we can, yes please, but how? Grab that Biodentine and that can help me to avoid that. If I can do the selective caries removal, don't expose the pulp and try to preserve the tooth structure, again that will help me with that. So there's so many different scenarios that with the presence of Biodentine, I can then practice minimally invasive and a treatment that will serve the patient best.